This is Lee Zakanamara Thoroughbred Gelding. He is 11 years old, and when he was younger he had an injury on his right front leg, which he had to have surgery on. This led to a large amount of scar tissue buildup in his right front leg, which causes him to have trouble flexing and in his pastern area. Due to this problem, he appears to be lame. So in this video, we're going to show you some techniques to break up the scar tissue and to increase range of motion.
And the ultra-wide head is used to break up scar tissue, and you can also use it on different areas of the body if they're really sore. It goes for 2 minutes at each section for 30-second intervals. So you just hold it to a section and wait for 4 beeps to go by. And then there's also another part, which is the high-powered probe, which you use on acupuncture points for 2-second intervals, and it helps increase the blood flow to the area. This part I will show you on his leg now. After you turn it on, you wait for it to read F4. And then you check the laser light. If it's working, you keep it at a vertical angle, and you put it on all the acupuncture points in the area that you want to work on. You wait for 2 beeps. And then once you've done all those points, you're done. Surpass is a topical ointment that you can use for inflammation and pain in a certain area, and it's also good for just increasing the blood flow and helping out with the breakdown of scar tissue. It keeps the area nice and moist so that it can heal instead of dry and getting all cracked. So basically you need to wear a glove just so you don't get it all over your hands, but you just unscrew the cap and squeeze out a little bit onto your hand. And then wherever the scar tissue is, or wherever you want to rub it onto, you just take a little bit out and you rub it on there. I like to massage the area, again, just to help break up the scar tissue. You can do pressure and rubbing massage, or you can do some friction massage as well. So that's basically it for Surpass. Okay, so if you have a horse that's really stiff in the leg or doesn't have a lot of flexibility, you can do some stretches and some range of motion tests. Originally, you should test out just range of motion, see how much they can bend it, and you should compare it to their good leg as well. So he's got pretty good bending and flexion in his fetlock and his knee. Not so much bending it forwards. They don't bend forward too much, but they can a little bit. And not so much from side to side and around. This would be the pastern joint here. So you can just sort of tell how it is in comparison to the other one. And then after you know like where they're stiffest, you can just sort of help them stretch it a little bit and push it a little farther than what they can do. And just hold it there for a few seconds. It helps if you would do this a couple times a day as well. You can also take them out, if they're lame and unrideable, you can take them out on the lunge line and work them around, and that'll help loosen up the area as well. If you can ride them, you can lunge them, or you can take them out and ride them. The pastern area is a little tricky just because it's not like a bend back and forth, but I just wrap my hand around his pastern to keep the fetlock from moving and help manipulate it from side to side and around in circles. It's gotten a lot better since I've been doing this. So.